Hey, Dr. Luke here. Want to get back into making some videos for our patients and try to bring as much value to you guys as possible as our members. And with it being spring, getting into summer here, May, June, um, wanted to touch on tick-borne illnesses and what you need to know about the different illnesses you can expose to here in Southwest Missouri. So, first off, I want to mention that we do not have Lyme disease in Missouri typically. So not one you need to worry about, unless you're traveling somewhere that does have it, like the East Coast. So here in Missouri, we typically have auriculosis and anaplasmosis are the two most common ones. We can also get some others like Rocky Mountain spotted fever, um, but primarily it's going to be those first two. Auriculosis is going to be come from the Lone Star tick primarily, and anaplasmosis is going to come from the black-legged tick. And if you do get bit, it's going to take about 1 to 2 weeks for you to develop symptoms of illness if you get it. Just because you get a bite doesn't mean you're gonna get sick. Um, and symptoms are usually going to be fever, headache, muscle aches, fatigue. Um, and we can do some lab work if we're suspecting a tick-borne illness given the time of year and if you've been outside and potentially exposed to ticks, or knew you had ticks on you. We can see a low white blood cell count, low platelet count, and also your liver enzymes may be elevated, your AST and ALT, which are inflammation markers in your liver. And so typically, given your history and those labs, we can make the diagnosis that you likely have a tick-borne illness and go ahead and get antibiotics started, which we use doxycycline primarily, takes care of pretty much all the tick-borne illnesses we can see around here. And we can do additional tick panels to determine what tick-borne illness it was exactly, but those take a while to get the results back and they're more expensive, and it really doesn't change the treatment. And so a lot of times we don't do them, but we can do those as well. But usually we're making the diagnosis much earlier than that just because it can progress quickly and get more severe if it's not treated early. So if you get a tick bite, there's no need, it's not recommended with auriculosis and anaplasmosis to treat prophylactically after a bite. Um, since you're not necessarily going to get an infection from every bite, it doesn't make sense to do that. We'll wait till symptoms arise if they do. And so um, with the Lone Star tick, 5 to 15% of ticks can carry auriculosis versus the black-legged tick, sometimes 10 up to 50% can carry anaplasmosis, but even still, it's not recommended to treat without developing symptoms first. So your best bet is going to be to try to prevent the tick bite in the first place, and so DEET and permethrin work well for that. Both are safe. For DEET, it's safe in pregnancy, in kids 2 months and older. In kids, you typically want to stay in the 10 to 30% DEET range. For permethrin, you can actually even get clothes or gear that's impregnated with permethrin. So if you're going to be going on a camping trip and know there's going to be a lot of ticks around, that can be a great option to keep you from having to continually covering yourself in DEET. Tick removal next. So you want to make sure that you don't squeeze the tick, especially when it's on you. You don't want it to expel its contents into your skin. You want to take a pair of tweezers near the head, flip it up, and pull straight up. Steady pressure. You don't want to twist or pull too hard. You want to make sure you don't get mouth parts left stuck in your skin. If you do, you can remove those with tweezers. But if you can't get them out, you just have to leave them and let them come out on their own. You also don't want to put petroleum jelly, isopropyl alcohol, fingernail polish, or a hot match on them to help get rid of the tick. That doesn't necessarily help, and it makes it more likely that you might have mouth parts what's left in your skin. Um, Last thing I wanted to touch on was not necessarily a tick-borne illness or infection, but in Southwest Missouri or the U.S. in general, we can also develop what's called a mammalian meat allergy, which I think is much worse than the tick-borne illnesses that we can get. Um, and typically that's the Lone Star tick, and typically it's after multiple bites, repeated exposure. It's not typically a one and done thing that you then develop the meat allergy, and it comes from being exposed to this alpha-gal, which is a carbohydrate that is in the saliva or the guts of a tick, um, and it's also found in a lot of mammalian meats like beef and pork, some wild game it can cross-react to, and so can be make it a lot harder for the people affected and make it hard to go out to eat. Some people can't even eat meat that's been cooked in the same pan or grill as they can't eat vegetables that have been cooked with meat or near meat, because they develop a reaction to it and need to carry an EpiPen and all these things. And so, um, again, it's hard to avoid necessarily if you're outside a lot, but take a lot of precautions. If you do get it, there are some potential options to desensitize your body to it. We use sublingual immunotherapy to desensitize people to respiratory allergens like pollens, but also can work for food allergies as well. And so we have a company called Allergy Choices that can make you some sublingual immunotherapy to help desensitize your body to alpha-gal potentially. I personally only have a couple of patients with the alpha-gal allergy, and neither of them have gone that route yet, so I'm not sure how effective it is, but there are options out there. So I hope you found this information helpful. And if there's anything else that you want to know about ticks that I didn't touch on, feel free to reach out, and look forward to making more of these videos, and hope you guys have a great day.